Given the absence of global fund and me say global fund USAID in our country, it's very essential that these interventions be sustained. So a critical step that UNEPO has taken to ensure that the project is sustained for of donor funding is by ensuring that communities who are members of steering committee continue advocating for community inclusion in key decision-making processes. But to a point, we are also calling on our national government and other development partners, especially the Art Africa, to ensure there are funding streams allocated for the continued implementation of this Copper CE project.
You have pandemics from epidemics. If you have an epidemic in a particular place and that is not controlled, it becomes global, it spreads to other parts of the world and it becomes a pandemic. As we had recently with COVID-19, it came and then it has exposed a lot of weaknesses in our healthcare facilities. Even the most advanced countries are hardly coping. So we must learn lessons from what happened in COVID-19 with COVID-19 2020 to 2021. And some of the lessons that we've learned is the basic fact that you can't just bring health care, a cure, and respond effectively to any outbreak or any pandemic or any epidemic without actually involving the community. The community must be at the core of it. With that lesson learned, I can assure you that Nigeria has decided to put in place structures that will ensure that the communities are always carried along, the communities are always involved, and actually the communities are part of those that draft whatever is it that is going to be implemented during response. You can never begin to plan during response. You have to plan before the response. It is said that failure to plan is planning to fail. Nigeria doesn't plan to fail.
COVID taught us a lesson, and the lesson is that we should be prepared before pandemics strike. We should not wait for it to come before we prepare. And it also taught us that the medical system alone cannot probably be able to withstand any pandemic. And that is why today we are here to see to what extent we can involve the communities to prepare for pandemics and ensure that we are ready for any future pandemic that comes. That is the discussion that we have here, how to penetrate the society, ensure that we meet stakeholders in the society and let them understand that, no, we need to prepare very well for any future pandemic. To be honest with you, we still have a lot to do.
One of the key success at the national level is that we are able to link with the National Platform of Risk Communication and Community Engagement, RCCE, at the NCDC level. This platform is where different informations about disease are being discussed, as well as many myths are being actually tackled. So at that particular platform, we are able to link up. Communities are currently having access to those platforms. NOMAD, we actually started with advocating for the inclusion of NOMAD, but later on, they released those platforms for all community and anybody that is so wishes to join so that he can have information about this. After the engagement, there is a built trust, there is a built relationship that increases between community, CSOs, and then the stakeholders in carrying out the activity. And communities are willing to participate. CSOs are also willing, as well as the stakeholders are also willing to get to the community as well as share information with the community. This is the beginning, and we hope this will continue. We try to make this inclusion for sustainability so that after Copper CE projects, definitely this will continue working in case of any law of funding, but this will definitely continue working.